I don't know about you, but when I need to make a major purchase, say a car or a new domestic appliance, I do a lot of research first. Well, my wife does really when it comes to stuff to do with the home. I find it easier just to agree with whatever she wants. We look in reports like publications like Which and go online to read reviews, compare prices and make a shortlist. If you're watching this video, then you already know that many of us go straight to YouTube to do our research. When it comes to our health though, it's not so straightforward. We put our faith and trust in the people and systems that provide healthcare, and most of the time it all works out. Health services are highly regulated and they must conform to rigorous standards. What about private healthcare? Well, the standards are just the same as they are in the NHS. What's different is that you can choose who does your surgery, when and where it's done. That puts you in a really powerful position because you're the consumer, and as we all know, he who pays the piper calls the tune. But having all that power means that you have to make decisions, and that's not always easy. Who are you going to choose? There are so many hospitals and surgeons, it all gets really confusing. Most people choose a surgeon by asking their GP, friends and family. It's a great place to start. After all, if you're thinking about having hip surgery, you probably know several people who are in the same boat. If you've been referred to a specialist, I thought it would be helpful for you to know some of the questions that will help you to make the decision to go with the surgeon you've chosen. I love it when patients come to see me with a long list of questions. It means that they've done their homework and are fully engaged with the process. I find that these patients often do better after their surgery. So where do you start? First impressions are very important. What's the hospital like? Is it clean and wholesome? Are the staff friendly and professional? Does your surgeon make you feel looked after and confident? Do you feel relaxed and unhurried? Once you've had your clinical assessment, there should be plenty of time for questions. These are the things that I would ask. Is your surgeon a specialist in hip surgery? Some surgeons do a bit of everything, but that's much less common these days. How many hip operations do they do a year? I'd choose someone who does at least 100. High volume surgeons tend to get better results compared to those who only do a few a year. I do about 150. Does the surgeon work with a well-established team? I've been with the same anaesthetist for over 20 years and we work brilliantly together. We have an almost sixth sense when it comes to looking after our patients. I've also had the same assistant for 20 years. He's a GP and a friend of mine from medical school in Oxford. Having a reliable, consistent team means that the surgeon can focus entirely on the operation. What sort of anaesthetic will be used? Most of us use spinal anaesthesia these days. It's safe and effective and gives excellent pain relief for several hours after the surgery. Does your surgeon work into the evening? I'm at my best during the day, and joint replacement surgery is quite physical. I like to be finished by 5 o'clock. What type of hip replacement will the surgeon use and why? Most of us use implants that have an excellent long-term track record. If not, then why not? The other thing that I'd want to know is the type of approach that will be used. Very few surgeons in the UK use the direct anterior approach. If your surgeon proposes to use this for you, ask how many they've done. The learning curve is about 200 cases, so I'd be very wary about having this approach if the surgeon hadn't had significant experience in using it. What happens if there's a problem after surgery? The other day a patient asked me if any of my patients had to be transferred out because of medical problems. It's a good question. I can think of a handful of patients in the last few years who've had to be urgently transferred into the NHS because of an acute medical problem. These are usually things like heart or kidney trouble that need treatment in an intensive care unit. Once the problem's been sorted out, we'll bring you back to the Nuffield to complete your recovery from surgery. Have a look at the website of the National Joint Registry. There's a link below. There you will find loads of detailed information about surgeons, hospitals, implants and outcomes. It will help you to make an informed decision about what's best for you. I hope this has been helpful. If you've got any questions or comments, leave them below and I'll reply. If you'd like to know more, then please get in touch. All of the details are listed below. Thank you for watching. See you again next time.